well. There's much more recognition that this is a problem. Again, fitting with the earlier talk, invisible symptoms are widely prevalent in MS. And, you know, a lot of these other symptoms, though, we might be able to kind of define them and classify them in the framework of physical health. However, we also know that problems with one's mental health is quite common with MS as well. So depression and anxiety, probably the two most frequently cited problems. So what we know, first of all, is people with MS are at risk of lower psychological well-being. We know that anybody, for a start, though, can be at risk of psychological well-being. And perhaps, now, I wasn't in the talk earlier with Jennifer and self-management, but she might have mentioned that fact. Did she talk a little bit about that? Maybe. Like, you know, anybody can be at risk of low psychological well-being, but people with MS are slightly increased risk. Particularly, there is a greater likelihood of experiencing depression and anxiety. And there's been lots of papers and research done in this area. That paper is just one that has summed up, it's a systematic review, brings together a lot of the evidence in this respect. I will just, for example, I'll just signal out one study in particular, because this is based on UK statistics. We don't have comprehensive statistics for Irish data, but this is based on MS registry data, which is a representative sample of people living with MS in the UK. So even though it's a few years old, it does give us a little bit of a snapshot into the extent of experiencing problems with anxiety and depression. So they used a well-known scale, just as a self-report. So basically people being asked questions about their own psychological well-being. And 47% scored outside the normal range for depression and 54% scored outside the normal range of anxiety. So roughly half, slightly more for anxiety, roughly half of people with MS are exhibiting some problems or some dips in their mental health, essentially. It doesn't necessarily mean, by the way, there's a clinical diagnosis, but we can think about depression and anxiety on a scale, okay? And of course that can vary between people and at different time points. But what's interesting as well about this study is that, say, anxiety seems particularly higher in women as opposed to men, and also women with relapsing remitting MS. So it seems to be that people with relapsing remitting MS are more likely to experience anxiety than those with progressive MS. However, depression is higher in secondary progressive and primary progressive MS. It's also slightly higher in men, but not to the same extent as, say, differences in anxiety. So I suppose the reason why I'm saying this is that there are maybe some personal factors that might put somebody at risk in terms of their gender identity and in terms of their disease progression. But I suppose the thing is, and these are there's a lot of unanswered questions, what we are less sure of is exactly why anxiety and depression levels are higher in MS. There could be biological factors, so it could be as a result of, say, the inflammatory changes, the autoimmune problems with MS. It could be the burden of symptoms. So people may be having to deal with a lot of symptoms and, you know, symptoms that can be quite severe, and those in themselves, you know, having to deal with that could lead to increased problems with depression and anxiety. I suppose what I'm most interested in is the role that maybe psychosocial factors might play in this, and I'll speak about some examples of these in just a moment. However, so I've spoken a lot about the negative. Okay, so we can talk a lot about negative, depression, anxiety when we talk about mental health. We can also then phrase that differently and think about the positive and think about, you know, having a high sense of well-being. People with MS, although some people are at risk of depression and anxiety, many people have actually a really high sense of well-being. And the thing is, this is in spite of any physical limitations. So people could, you know, have quite a lot of limitations physically. They could have quite a high symptom burden, but nevertheless, they could be perfectly happy, you know, to have a high sense of well-being. So it is also important to understand why that is the case. So why are some people just happier and have a higher sense of well-being than others? Again, it's just to draw the distinction between the physical and the mental health. So somebody could be, you know, at very advanced stage, let's say, have a lot of symptoms, you know, physically not doing as well, but mentally and psychologically doing great. So, and then vice versa. So these things, we do have to think about them differently. Now, I will just introduce, this is kind of quite a well-known model of health, and when we're trying to understand why somebody has a high or a low sense of well-being. We can talk about the biopsychosocial model. The biopsychosocial model basically says we can broadly think of 3 main factors which might influence a person's mental health or their well-being. So we can think about biological factors. So again, in the case of MS, it could be one's physical health or their level of disability. We could measure that in, in an EDSS score, for example. You could think about genetic vulnerabilities, etc. The thing about these factors is we would say they're unmodifiable, or so they're less easy to change. You can't really change your genetics. It's more difficult to modify somebody's level of disability, for example. Obviously, there's treatments that are aiming to do that, but it's more difficult to work with that. However, if we look at, say, the set of psychological and social factors, these potentially are more open to change. So when we think about psychological factors, somebody's level of self-esteem, how they feel about themselves, their ability to cope, social skills, and then this then goes into the actual social support, peers, family relationships, family circumstances, school, work, employment, etc. Obviously then these domains can overlap, but I think when we try then to think about interventions, which are ways, in other words, to improve somebody's psychological health, it's probably worth focusing more so on these factors, so how a person's outlook, a person's family support, as potential ways of increasing their well-being. And also, just to introduce, when we think about the definition of health, this is this is an old, but it's a frequently used definition of health from the World Health Organization. And it's the idea that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. But I think, the important thing here is we often, I suppose, think about health as something physical. So is one physical healthy or not? But health expands to the mental and social domains as well. And also just another definition which I came across recently as part actually of my IPOSI course by Huber et al. And I think this definition is much better when we think about health in the context of MS. Health as being the capacity of an individual or indeed a community to adapt and self-manage in the face of physical, mental and social challenges. So in other words, in MS we face challenges all the time. They can be physical, mental or social. But if you have the capacity to adapt and, maybe again, community, those around you have the capacity to adapt, that can enhance your well-being, okay? So the idea of thriving as opposed to just surviving. Now, in terms of my own particular research interests, so I am generally interested in the kind of set of factors, these psychological and social factors, and how they might be harnessed to enhance somebody's well-being. I also, and this probably is coming from my background as kind of cognitive scientist, we talk about representation. So it's really just a person's mental representation or the thoughts that they have about, it could be anything, about the world, about their MS, for example. So in other words, how they frame your outlook, I suppose, is another way of thinking about it. I'm particularly interested in the kind of expectations that people form about their illness. And these expectations are probably likely to have an impact on your quality of life, okay? And quality of life is very closely related to this concept of well-being as well. And often they are used interchangeably. So I'll just talk a little bit about this idea now and give you some examples. Just look at the role of expectations generally. So first of all, when we think about expectations, everybody, we're always forming some kind of expectation about the future. Now, sometimes those expectations are very well defined. You might, expect, to leave here at such and such a time and to get home 2 hours later, let's say, depending on where you live. Now, that may or may not come true, but, that's a very clear-cut basic expectation. But a lot of the time, the expectations that we form are more implicit, let's say, okay? So they're more unconscious. They're assumptions is a better really way of putting it. We have assumptions about what is going to happen or what may or may not happen. The problem in MS, however, is that, if you think about, typical person before they're diagnosed, let's say, they might have expectations about their life course, and then those expectations are thrown into disarray. So the difference between expectations and reality. it can be quite dramatic. And if you ask anybody, well, what, you get MS, what should I expect? Really, the one thing you should expect is uncertainty, because MS, as we know, and we can look across the room and speak to everybody else. Everybody has their own unique experience. It's very unpredictable. Now, I guess there is a lot of research going on in terms of trying to increase our, say, a physician's or a neurologist's knowledge of likely progression, let's say, but really, certainly we don't have all the answers. It is unpredictable. That was one of the main characteristics to define MS. So we know, however, some research at least suggests that how people actually adapt to this uncertainty may influence their later well-being. So people diagnosed with MS, they have this experience of uncertainty, but if they're okay with kind of living with that uncertainty, they might be in a better place to adapt and to self-manage. The thing as well, just to know, is people find it hard. We find it hard to cope with any form of uncertainty. So the reason why this is the case is going back to, as I said, what my earlier research was concerned with. Generally we're motivated to make sense of the world. That's just what we do as people. We have questions, we want to seek answers. That's why, we talk to other people. That's why we plan to do things. We want to make sense. We want to feel like we have a sense of control over what happens to us. Think about just to give you two common everyday experiences. Does anybody lose things or mislay things regularly? Anyone lose their keys, or their phone is a common thing, or actually, as was spoken about earlier in Rashan's talk, losing your car, not knowing where you parked your car. I know that's happened to me a few times. The thing is, all these things, are examples of uncertainty. So where did I park my car? Where did I lose my keys? Even if, let's say, you lose something and you don't necessarily need it at that time, not knowing where it is going to bother you. So we're not comfortable living with uncertainty. And another example is binge watching, right? So with the advent now of Netflix, it's becoming a lot easier. Does anybody like watching box sets on Netflix? Anybody kind of, you get to the end of an episode, it's on a cliffhanger, and you want to, you're like, okay, what time is it? It's midnight. I really should be going to bed, but I really want to find out what happens next. So you'll skip on to the next episode, and then, binge watching. Again, the reason why people do this is because they want to resolve that uncertainty. They want to, we're kind of nosy. We want to find out what happens next. We want to make sense of information. So really, again, it's a basic human experience, really. That's what I'm trying to say, is that we do not like when things are out of kilter, when we can't really predict, when we can't understand things. However, we also do know that there are individual differences. Again, you might know somebody that's very disciplined. They will only watch one episode at a time. They'll only watch, they'll turn it off. They'll have to go to bed. People differ in their ability to tolerate uncertainty. So we talk about the idea of intolerance to uncertainty almost as a personal and individual characteristic. And in the general literature, this isn't specific to MS, but generally speaking, people that have higher levels of intolerance to uncertainty tend to be more likely to experience depressive and anxiety disorders. So again, it's indicating that somebody's ability to cope with uncertainty has an impact on their well-being, or at least is associated with their well-being. And I came across recently a very interesting study. It was a pilot study, so just with a small number of people in MS. And the aim of these sessions and these kind of therapy sessions was to help people to become more tolerant of the whole inherent uncertainty that comes with living with MS. And this intervention seemed to be quite successful in that when people became more tolerant of living with the uncertainty, they were better at accepting just the whole idea of living with MS. They had higher MS acceptance, we might say. And here's just an example of an extract from one participant. So, from going through these sessions, they just say, knowing it's okay to have the thoughts I have about MS, but at the same time, not allowing the thoughts to be any more than that. A thought that probably cannot be answered and won't in this life, but it's okay to just let the thought go and float on and to move on. I particularly like this quote because it highlights the fact that as we live with MS, we do think about it. It's there, and sometimes you will have the thought. Sometimes it will enter your consciousness, and you will focus your attention on it, and it might bother you. But I think the thing is what this is showing, that you can still have those thoughts and be okay with it, and move on, and do whatever your next task is. It's not necessarily a bad thing to think about. Just living really with the condition and the challenges that might have. Yes. Oh, sorry, yes. Okay. Yeah. No problem. Thank you. So, I'll just go back then to the whole idea of adapting to an MS diagnosis as well, and the kind of reactions. And those of you that were diagnosed, you might think about what your own initial reactions were, and you might have had many reactions at the same time. And common ones include shock, worry about the future, fear even, and we'll talk about this in a moment. But you might have experienced positive reactions as well. You might have experienced relief because it might have been a label that would answer any kind of questions or, again, uncertainties that you had. If you think about all these reactions, they are actually really tied up with our experience of uncertainty. So certainly the negative ones, shock, worry, fear, it's like, what's going to happen to me? What does this mean for me in the future? And the relief, on the other hand, is like, okay, I'm glad I have a label, I can rationalise, I can explain the diagnosis to myself. And these experiences, by the way, are also very common reactions among family members. So in our work looking at paediatric MS caregivers, we're looking at the literature in this area, and we've shown these reactions are common. Okay, so it's not just the person with MS that has difficulty sometimes dealing with uncertainty, but the wider community and family. So if we drill down into this in a little bit more detail, we might ask, what are we uncertain about in MS? Now, the uncertainty may stem from a number of different expectations or lack of expectations that we may form. These might include expectations about general prognosis, about treatment is a big one. Will this treatment work for me? The efficacy, in other words, or will this treatment lead to side effects? People might have expectations about their symptoms, what symptoms they might get or might not have, or just more generally, like future capabilities. Will I be able to stay in work? Will I be able to care for my children? Whatever that might be. People, we know these thoughts are common, so I think, again, it's important to acknowledge them as opposed to tiptoe around them. People do form these kind of expectations. And the thing, though, when you go in and talk to your maybe treating neurologists or healthcare professionals, it is important to acknowledge that the expectations of the healthcare professionals may differ to your own expectations as well. The main way in which they differ is, I suppose, for you, it's real consequences, and there's practical consequences, there's emotional consequences with that, whereas maybe from the healthcare professional, they might think more in terms of statistics, not all, but I'm just saying, just from that objective standpoint, if somebody is asked about what is so-and-so's prognosis or what is the probability that this treatment will work, the physicians and neurologists, they may deal in numbers and probabilities. People don't think in those terms. So what we're doing at the moment, I suppose, is we're starting by trying to gather together evidence, and don't worry about reading this. I won't read it out. But really, the idea is we're trying to look at the review of a literature in the area, systematic review, and we are looking really just broadly about what has been done in relation to the role of expectations in predicting a person's well-being or their quality of life. So we're trying to gather together the evidence, and this is still ongoing. So we're screening, we're reading through a vast amount of literature and studies in the area. What we are finding, I suppose, the trends that are emerging is that there's different ways in which people with MS would think about the future. So we can think about this in terms of the emotionality associated with it. So expectations, in other words, they could be neutral. People might make just predictions or make estimates of likelihood. However, as I said before, generally people find it difficult to think in those terms. What is more common is thinking about the future in maybe either a negative or positive, and again, aren't mutually exclusive. People with MS can think about, they can have kind of fears and worries, but also kind of more positive hopes and expectations as well. So yes, the negative, and I'll talk more about some examples in this. People can have fears, they can worry, they might have a pessimistic outlook. On the other hand, people can think more positively, they can have hopes, they can be optimistic. Another thing which is written about a lot in the literature is this idea of self-efficacy. So self-efficacy is really your confidence in yourself to carry out tasks, to overcome challenges. So like, again, it's what we might say a future-oriented cognition. It's really focusing on your ability to be able to do things, to the things that you want to do. So I'll talk a little bit about some of the negative and some of the positive expectations, and then I'll kind of end the talk by just discussing general advice, I suppose, for maintaining your psychological well-being. So I said I'll start with the bad news first, and then we'll get into the better news. So the bad news, we'll just talk about fear. So, I mean, if I kind of asked, I mean, maybe even if I do a show of hands, who here has experienced some kind of a worry or fear in relation to your MS or your family member's MS? Okay, so a lot, most people are putting up their hands. Like, I think the reason why I asked that is, again, I think it's a common experience. That's not to say that it is an all, it's a continual experience, or it's a traumatic experience, but I think it's a normal human reaction, I think. So like people might have fears about progression. They might fear a relapse. Am I going to, I have a wedding planned next month, am I going to relapse? I might worry about that. People might worry about specific symptoms. They might say, right, I have an event, or I have an important work meeting tomorrow. I'm worried I'm going to be fatigued. People might fear, again, the effect of employment. They're like, can I keep up my job? And how long? And, can I tell my employer? People might fear stigma from others as well. So it could be from unemployment, but it could be from, almost like coming out to family members and friends. What thoughts are they going to have? So these are just a few examples of the fears. And even, just before I came here, I did an informal search through social media. This is not scientific evidence, and I'd caution, but just it is really showing that these experiences are common. So I looked at Shift MS, just did a search. So this is a social media platform for people with MS to discuss topics. This is an open forum, so it's publicly available information as opposed to a closed, say, Facebook group. But you can see that fear is a common experience. So these are just topic headings: just diagnosed in fear all the time. I can't stop feeling scared for the future. Fear of relapse, ? Is there any hope for my future? So again, it's highlighting that these are thoughts people have. And, as I was thinking about this, I thought, well, this actually is not an experience that is unique to people with MS, because you can see this in other conditions, and probably the most commonly researched condition focusing on fear is within cancer. Okay, and again, this psycho-oncology, focusing on the psychological impact of living with cancer. Here, there's a construct known as fear of recurrence, and fear of recurrence has been researched quite a lot, and we've looked at this as well in different groups. We've looked at it in prostate cancer. We've looked at it in caregivers as well, worry and head and neck cancer caregivers. So, again, fear of recurrence is common for survivors and family members. So what fear of recurrence is essentially is you're looking at somebody that has maybe been treated for cancer, and physically they might, again, their clinician might say, their treating clinician might say, you're very low risk of recurring, but nevertheless they experience these fears, these worries. So the thing is, people can experience fears regardless of their clinical risk. So again, it's the difference between one's mental health, their worries, their anxieties, physical health. So really the same is probably true for MS, because somebody might have a fear of having an effect, fear of having a relapse or symptom. That doesn't mean it's going to happen, and your treating neurologist might say, okay, such and such, we've looking at your past records, it's very unlikely that X is going to happen. So remember, people aren't good really at making predictions about what is or is not going to happen. And just to give you an example of research in the area of MS, this is one interesting study where people were asked to give their own personal estimates of risk. So essentially they're like, it is a little bit like trying to measure their fears of the worst, their risk of progression. So they were asked, okay, give me your estimate for progressing it. 2 years, 10 years, lifetime. So first of all, unsurprisingly, people that gave higher risk perceptions tended to be more bothered by intrusion of MS-related thoughts and feelings. So they, they were more worried, I suppose. I mean, it makes sense. So they had a lower sense of well-being. The important thing, again, just to note, though, is that whether somebody had a fear or not, that was independent. It was separate to their clinically assessed disability status. So in other words, people might have a higher level of disability. They mightn't have high risk perceptions, and they have a better sense of well-being. People have a lower level of disability, they can have high risk perception. So it's really, in other words, it's the outlook often that a person has and the worries that they have that is impacting on their well-being rather than their actual physical health. So, as I said before, people aren't good, we're not good at making predictions. We might have worries, we might give estimates of our own risk, but we're not good. And when I say we're, I don't mean people with MS, I mean people in general. We just we're not good at making predictions. And this does, again, just to raise the issue of prognosis as well, because some interesting work was done by Denison et al. Again, this is based on information in the UK. Most people actually, interestingly, want to know about their prognosis, but this isn't always discussed with healthcare professionals. So there's kind of a mismatch between what people often want, what patients want, and what the healthcare professionals are willing maybe to discuss. Again, it's important, a disclaimer here, like lots of people don't want to know about their prognosis as well, and of course that's absolutely fine. I think the thing is people have different preferences. This is just looking at the information in terms of percentages. So like for example, some people have a strong preference for prognostic information, like most people do, but like if you look at this bar here, about half have never discussed it with their healthcare professionals. What I also found interesting about this study is that about 2/3 of people thought kind of about their prognosis, let's say monthly. So it is something on people's mind, and I suppose the thing is, if it's not always discussed, if it's not raised with healthcare professionals and maybe you want to have a discussion, then that might be something to consider doing. Now, a lot of the time, prognosis is very difficult and people mightn't have the answer. But sometimes, I suppose, this research is suggesting people want to open up a conversation on it, and maybe that's not a bad thing. Now, these kind of issues have a lot of implications for what was known as treatment decision-making. And we know that there's so many treatments available, and this is not an exhaustive list, this is just a few. It can be very overwhelming, and people in this room might have had to make a decision over which treatment to take. And the thing is, when you're trying to make a decision over treatment, you're trying to give estimates of how well it will work for me, what are the side effects, what things do I not want to experience. And the problem again here with this whole idea of fear is that people are worried about what might happen. That might override their ability to objectively assess the actual risk. So for example, one study found that when people were asked to kind of think about different DMTs, disease-modifying therapies, people tended to underestimate often the time benefits. So people think, okay, it's not going to work for me, and they tend to overestimate the risk. So again, people are a bit more worried about what might happen taking a treatment than the benefits. So again, it's suggesting that people aren't really thinking logically or rationally, if you want to use that word there, about their treatment, because again, it's really tied up in the emotionality and the fear. However, interesting as well, people in this study, if treatments did offer high benefits, they were preferred in expensive high risk. So people are often willing to take a risk. When I say risk, it's like a risk of, say, a negative effect. People think about these things differently. The one thing we all know, though, is that people with MS want information. So I think most of you are here today because you want information, you want to learn about trends in research, you want to talk with other people in the community. So we all have a lot of questions, we're eager to learn. The thing is, though, searching for information can sometimes lead to more fears as well. And often in research, we talk about this effect called the nocebo effect. You might have heard of the placebo effect. The placebo effect, as you're probably aware, is when somebody expects or believes that they're taking a drug, let's say an active treatment, they tend to report feeling better, even if they're not actually taking a drug. The nocebo effect really is the idea that when people believe they're taking a drug, let's say, that's going to lead to a negative effect, like your hair falling out or extreme fatigue or stomach problems, they're more likely to report them as well. So if people are expecting a side effect, they're more likely to report experiencing them. So that's a nocebo effect. So, and the idea of the nocebo effect is often that can result from reading about information about a treatment. So it is kind of almost a dilemma. How much information should you read about your prognosis and your treatment? The thing is, is that there is a danger, though, of searching for information online. If you're searching for out-of-date or unreliable information, that can lead to more fears, more anxieties, more worries about the future. So I'm going to just, I'm quoting a tweet from a well-known MS blogger, and I just thought this really kind of summed up the whole issue and the problem with searching for information online. Because she says, I need your help. Teenager sent me this article that upset him last week about the prognosis for MS. What can I say to reassure him? And it's linked to a web page that looks legitimate. It looks like, okay, this is a very good, reliable source of information. It's from some library, we can see here from the start. Now, this text is very small. You don't have to read it all, but I'll just kind of just enlarge one part of this. One part of, say, average lifespan of 25 to 35 years after the diagnosis of MS is made, and often stated. So if somebody is reading that and they're diagnosed in their early 20s, that can be quite shocking. The point is, this information is vastly out of date. It's based on really old information. It's not referenced. It's rubbish. Basically, it's inaccurate. So the thing is, you can imagine if somebody's coming across, and this in this case it's a teenager, so a young person worried about their family member, coming across this information can obviously lead to fears. So searching for information online is a dangerous thing, but people will look online. So how many people have used Google to search about MS? Honestly, hands up, how many people have typed it in? Okay, I think you're being quiet. I think there's more people. I have as well, and I know, I'm kind of research background. People do, because they're hungry for information. Again, it ties back to this whole idea of uncertainty and reducing feelings of uncertainty. So the thing, I guess, we need to know is that when we're looking for information, we need to seek appropriate information and appropriate resources to manage our symptoms and to think about the decisions that we make. Okay, so I've focused a lot, I know, on the negative, okay? So talk more about the positive as we get to the end of the talk now. So, the thing is, so people can experience fears and worries, but often, a lot of the time, people experience more positive thoughts, feelings, hope, optimism, self-efficacy, and these other kind of feelings. So we know there's a lot of study in the area of optimism. Optimism and hope is associated with better outcomes in chronic illness. And we've done some work with my collaborators. I've done recently, written some papers in this area, focusing on, first of all, caregivers, people with MS. Just general caregivers. I haven't specifically looked at MS yet, but we have looked at people that are suffering from a chronic illness as well. And I think there is a lot of overlap between the fears and the hopes people have in relation to, say, chronic illness. So we've shown that optimism is very important. And this is across a very wide European sample of about 10,000 people with chronic illness. But we also have investigated the role of other positive appraisals. So these things include a person's feeling of autonomy, so feeling of being in control, and again, maybe being able to make their own decisions, feeling like they have a high level of confidence. Sense of purpose as well is something which is receiving a lot of attention as well. Feeling like you have kind of some kind of purpose, meaning in life, and resilience as well is another concept which is getting a lot of attention. So if people feel resilient, so in other words, people, resilience is the idea that if you are sometimes experiencing tough times, experiencing the challenges of living with a chronic illness, the ability to kind of think about strategies to overcome that, can lead to better outcomes. So all these kind of positive outlooks and positive appraisals are associated with enhanced well-being. So if we think about, then how can psychological well-being be maintained in MS? Trying to foster those positive appraisals is important, trying to focus on trying to form positive expectations is important. But also, obviously, clearly, and I mean, I should have said this first, if you are concerned about your well-being, obviously it's very important to speak to a professional about this, whether that's your GP, your MS nurse, or your neurologist, to try and think about the causes. If it is caused by a symptom, like if you're anxious about experiencing a certain symptom, maybe discussing potential treatment options for that, and getting the information. Yes, and that links with my next point. Seek appropriate information as well. The appropriate information is so powerful. So information can, trigger fears, but it can also alleviate fears. It can reassure people as well. And importantly, okay, as that little cartoon says, I'm not okay. It's okay to not be okay, and especially living with MS, because it's not, it's no walk in the park, But the other thing as well is seeking out social support is so important. And this is why events like this are incredibly powerful, because you're surrounded. And I found this very valuable as well. Getting to meet other people in the MS community and link in with others, talk about and share your experiences. It's incredibly valuable. Loneliness, we know, is getting a lot more press and attention in the literature. Feeling lonely, that gives people a strong likelihood of experiencing lower well-being. So trying to, and it doesn't necessarily mean actively getting out there, because that's not always easy when you're limited, but finding ways to seek out support, whether it is online or other groups, is very valuable. Now, a common concern, and this actually came up in the talk earlier with Professor Dosnair, in terms of maybe, people sometimes don't understand the concept of invisible disabilities and visible symptoms. And this is a common concern. It may be a lack of understanding of MS from family members, friends, and colleagues. And, we could think maybe there are things we could do. Maybe there could be general awareness about MS and other invisible disabilities. It may actually help this, because if people feel like others can understand, can empathise with them, might make them a little bit easier. But as I said, just to echo what I said already, connecting with the MS community is of great value as well. And then, of course, there's some more general advice for enhancing well-being. We know exercise, being active is important. Said connecting with others, learning, gathering information, giving back. Maybe that fits in with a sense of purpose, and just take notice, be aware. And this is another slide. I know the writing is very small here, but I think a lot of the MS organisations, including MS Ireland, but also this is from the MS International Federation. A lot of these organisations are recognising the various ways in which we can maybe enhance people with MS's well-being and their quality of life. So there's 7 principles here. Empowering, empowerment is so important. Giving people that feeling of having autonomy and having a say in their own decisions. Being able to access appropriate treatments. Having a support network, which I've mentioned already, but even things like working, volunteering, or just being engaged in things that fit with your lifestyle. But of course, then there's things that are often out of our control, which is accessible public and private spaces, technology and transport, and I know some of those concerns were raised earlier in the talk, financial resources and supportive attitude and policies. So we can't really do much about this, but maybe we can lobby and we can advocate for these services as well. So just final slide to sum up. People with MS are at risk of lower well-being, but they need not be. And everybody is different, and this experience varies across individuals, as we know. I guess the key message that I have for today is, expectations that we form. Think about the expectations that you form, because this can influence how you feel, and maybe fostering more positive expectations and feelings of empowerment, self-efficacy might have a more positive effect. We need to think about how we can enhance well-being. Social support is incredibly important. The MS community, family and friends as well. But then the final thing is just to remember to pay attention to your mental health as well as your physical health. Thank you.
I'll ask you to stay up here for a few questions. Are there questions from the floor for? And Jason will have Jason, are you here with microphones? Yeah. Well, we'll ask you to speak up until we can find the mic. How's that?
Okay, hopefully you can hear me.
Yeah.
You answered most of my questions in the course of the talk. But one is a suggestion that I totally take what you say about looking online is really dangerous. But there's a lot of really good information out there. And perhaps the MS Society could look at publishing a list of reliable web pages where people can go for good information.
Yeah.
Because, you know, your consultant is never going to explain your treatment to you properly.
Yeah.
And very few people are trained to read the research papers. Now, fortunately, I can, but that's a very small minority.
Yeah.
So we should be looking at some way we can direct people to reliable sources where they can look at stuff written in plain English, because anything can be written in plain English. And maybe even it's something we could do maybe it's even something we could do to have people just summarise the research in very plain English. And I am aware of the tendency now to have a sort of an abstract which is easily understandable by anybody, and that you don't need to drill down. The other thing which genuinely worries me, you're doing a trawl of the literature going back years, when the quality of research was so poor as to be embarrassing and frightening. I presume that you're grading it, and like in medical research, most of it will come out as of poor quality, if not just plain outright dangerous, and that you're going with the good stuff.
Yeah, thank you very much. They're both excellent points. Just to your first point, information, as I said, it actually can be very powerful, and you're absolutely right. Finding the right information is so important. There are actually a lot of organisations and websites that are trying to collate information in a more readable format. I think the MS Trust is quite good in the UK. They have updated research updates like that where they're trying to digest information. I think Bart's MS blog as well. Is anybody familiar with that? That's kind of a team. Yeah. You know, yeah, so like that's another fantastic resource. And I mean, following again, kind of reputable people. People on social media and Twitter, you know, is excellent. I agree with your suggestion of maybe gathering the information, maybe MS Ireland or another go-to site. I think having that go-to and having it up to date. And to your second point as well, yes, for our particular study, we are looking at the literature going back, and we will be appraising it. But what's interesting is that, you know, as this is very much focused on quality of life and well-being in MS, really, most of the studies have only been coming out over the last few years. It's quite new, really, that researchers are shifting their attention to well-being and patient-reported outcomes. So actually, much of the work that we're looking at in this space is really quite recent, actually. People are just really paying attention to it now. But thank you again.
Other questions? Hands? Anyone in the back there? I don't hope I haven't ignored anyone there back there, but it's the spotlight sometimes. There we go, one more. Thank you.
Oh, two beside one another. We're not in collusion, I promise. I just want to say, well, first of all, thank you for a really interesting presentation. It chimes with something we've been trying to do in our branch, is to get people out, to get them mixing, to be part of a community. And I saw all the information that you gave. Are you aware, from all the work that you've done, of a hard cost-benefit analysis that has been done? And the reason I ask is because we do spend money on social outings. We're out collecting, volunteering, doing bucket collections. And I will defend to anybody the social events. But I do sometimes wonder, are people looking at us heading off to the theatre thinking, is that what they're bagpacking for?
Yeah, sorry. That is an excellent point. I absolutely agree with you. I think we need to actually really perform evaluations of the services that you are doing to actually further argue and further provide evidence for supporting the funding. So there are ways of costing benefits. You know, there's economic. I'm not a health economist. I do work with a health economist, but I think, you know, it is something that needs to be thought about, because, you know, often when we think about economic indicators, there is a lot of emphasis on working and hours that are lost due to attending medical appointments. But what is gained in terms of productivity by engaging with others, yeah, it's there. So yeah, I agree with you. It doesn't mean I don't really know how best to do, but I think it's a conversation that we need to have.
Thank you. I was just wondering whether you have come across on it.
Yeah. No, I haven't. In terms of personally coming across, again, as I said to you at the start of the talk, this is actually quite a new research area for me. So at the moment we are just focusing on kind of the quality of life, the wellbeing indicators. I suppose the economic side is another arm to it. So I am familiar with work, but I think it's certainly worth exploring.
Thank you very much.
Thank you.
Rebecca, thank you so very much for your time.